Alrighty, so let's get started for today's webinar. And the topic today is why laser therapy is a versatile and effective modality for your clinical practice. And my intentions for today's webinar is to provide an update on laser therapy, its effectiveness. I'll talk a little bit about some other modalities and how they may be compared to laser therapy, some of the research and especially more recent research that's come up about laser therapy. And so I'll do my best to just kind of fill in the gaps if you're interested in adding this to your practice, what you can do with it with your patients, that kind of scenario. And I'll talk a little bit about BioFlex and especially what makes us quite unique and different from the other laser therapy companies out there as well too. If you haven't done so already, just let me know your name, where you're from, and your interest in laser therapy. I do really appreciate that by doing that. I'm saying hello to David Barker in Las Vegas. I don't know what you're doing in Vegas, but hopefully you're having some fun. And it looks like we have folks from everywhere from Edmonton to Collingwood. I'm currently in my home office in Creemore, so pretty close to Collingwood, Travis. So let's enough of me mumbling along here. Let's get started. So really what I'd like to do today is give an overview of what laser therapy is. Even if you've been using it for a while, this is still a good refresher so that you can explain it to your patients and perhaps any referring doctors, that kind of thing as well too, especially how it works and some of the more recent evidence. And some of the evidence has been out there for a little bit, but is quite strong, and how it compares to other modalities as well. And then I'll talk about the clinical applications and a little bit about obviously BioFlex and our equipment. And then of course, I always have time for Q&A at the end. The webinars are always recorded so that if you have to leave or in future, if you want to sign up for a webinar but can't attend, then as long as you register, you'll be sent a link to watch it again once we edit the video, and that usually takes about a week or so. So just let me know again where you're from and your information. I'd much appreciate that. So laser therapy, there's lots of different names for it. I think there's been over 70 plus names that have been cropped up in the research, and everything from red light therapy to phototherapy to all sorts of different different terms. And it got a little confusing. So quite a few years ago, pushing 10 years now, I think, maybe not quite 10 years, maybe 5 or 6 years ago, the World Association and the North American Association for Laser Therapy decided to come up with a better term. And they came up with what's referred to as photobiomodulation therapy, or PBMT. And that's what's used now in peer-reviewed research. The older acronym or term initially was low-level laser therapy, then they changed it to low-level laser/light therapy. And the reason why they decided to change the terminology was for the fact that a lot of clinicians were using other sources of light to achieve this clinical effect, not just laser diodes. So this isn't laser therapy. Even though I'm going to use that term, it's really light therapy, and specifically photonic or photons of light modulating biological processes in cells, hence the term photobiomodulation. So you can use LEDs provided that they're the right wavelength and you have enough of them and they're powerful enough and you treat for long enough. And you can use laser diodes, but each has their advantage and disadvantage. And you can even use fluorescent bulbs if you know what you're doing for specific applications as well. So terminology-wise, you're going to probably search for PBMT or LLLT on PubMed. And then if you're interested in a specific condition, you can add that as well. So for example, and neck pain. So the definition of this phenomenon of, I'm going to say laser therapy to make it easier for everyone, but again, it's photobiomodulation, is that it's a form of light therapy that uses non-ionizing forms of light. So this light will never harm your patient. And it can include lasers, LEDs, fluorescent broadband lights, as I mentioned earlier. And the light wavelengths are typically in the near infrared spectrum and the visible spectrum. It's a non-thermal process, so there should be no heat being generated. In fact, heat inhibits this photobiomodulation reaction, so I would not advise using any light that causes heat. And it involves what's referred to as endogenous chromophores, which are photoacceptors inside cells. And when they interact with light or photons of light, it causes a photochemical or a photophysical reaction that has a net positive effect on the cell. So this whole process of accepting photons of light, if used in the right wavelength and the right dosage, can be very helpful in reducing pain, reducing inflammation, accelerating cellular and tissue healing, wound healing, that kind of thing. And so that's traditionally how it's used in clinical practice. The first sort of use of artificial light or phototherapy was Dr. Niels Finsen. He was a medical doctor from the Faroe Islands, which is a group of islands in between Iceland and Denmark. And he was, he sort of discovered the use of red and ultraviolet and I think even infrared wavelengths therapeutically. He used incandescent bulbs. Actually, there are carbon arc lamps, and he used filters. And initially he experimented on animals, and eventually he realized that it had a positive effect on metabolism. So he treated smallpox and skin tuberculosis and some other conditions quite successfully for reducing the severity and the symptoms of these diseases. Smallpox, as you probably know, is one of the worst epidemics and pandemics in the entire world. It's been eradicated now. Actually, I saw a chart recently that listed all the different pandemics over the years, and smallpox and the plague, you know, are way up there as far as millions of people that were killed. COVID, I think, is still pretty high. I don't know the count now, if it's 5 million. Maybe Mark Gross, our professor emeritus on the Gulf Islands in British Columbia, can give me an update on that. So after, I'm going to back up a bit. After Niels Finsen did his work, he won the Nobel Prize for his work. So it was well recognized, but when he died early because of complications due to Pick's disease. His work kind of was not continued on in any great extent, even though a lot of people had heard about it and it was used to some degree. It really wasn't until the use of a laser by Andre Mester. And he was actually trying to use a high-powered red laser to eradicate tumor cells on the shaved abdomens of rats. So in this first example, he injected, sort of made little slits and injected tumor cells, and then he irradiated it with what he thought was a high-powered red laser to try to eradicate or literally burn out the tumor, because he was reading some medical research papers and he wanted to actually eventually do this on humans. But what he noticed was that the red laser had a couple of effects. One was that it grew the hair back or the fur faster, and the lesions, the lacerations, healed faster than the control. And he also realized that the red laser he was using wasn't an ablative or hot laser. It was actually low powered, and that was just a mistake in calibration. So when he compared it to the control, he realized something funny was going on here and not what he expected, especially given that he wasn't expecting to use a low-powered red laser. But because he observed, especially the lacerations healing faster, he decided to do some further experiments. And this, he did skin flap wounds. So he cut little flaps of skin off rats, some of which were control. You can see the bottom here, the control. And then he then chose ones that he used that low-powered red laser, and specifically he irradiated one of the wounds. You can see there's two adjacent wounds. And what he observed, firstly, was that the wound that was directly irradiated with the red light, in fact, it was healing faster. And you can see in comparison, it's healing significantly faster. But what he also observed, and this is highly important, is that the adjacent wound, which was not touched by red light, was also healing faster than the control. So he concluded two things, Andre Mester did, and that is that this red light had some type of metabolic effect by increasing the rate of wound healing when it was this, the cells in the tissues were directly absorbing red light. And he also observed and concluded that this phenomenon somehow was translated or carried in the circulatory system, obviously through the blood, to adjacent areas. So the effect could be mediated in the blood as well. And nowadays, we know this as a remote or systemic effect. And to be quite upfront, BioFlex laser therapy, a big part of what we do focuses on the systemic effect, not just the direct effect, whereas most competitors that only use a laser are doing more of a direct effect, which I'm not saying is not effective. I'm just saying that by adding this systemic effect, you'll have a much wider and potentially deeper way of treating with a photobiomodulation. So how this whole phenomenon works is we need to understand what a photoacceptor is. And the easiest analogy is, in plants that have chlorophyll, chlorophyll absorbs the energy, a photonic energy, obviously of the sun, and it converts the energy to chemical energy inside the plant. And that allows the plant to grow. That's a photochemical reaction known as photosynthesis. There's lots of photoacceptors inside or on our body or in our body. Ones that you probably are aware of is melanin that absorbs ultraviolet light, obviously, so that this damaging ionizing radiation doesn't go deep into our body and cause cancer. Hemoglobin has it can absorb light, it actually absorbs most wavelengths and reflects red, or at least some red. Myoglobin, there's many different types of photoacceptors in the human body. Now, how photobiomodulation or laser therapy works, it really focuses on the ATP production in the mitochondria. And so this really harkens an understanding of aerobic respiration, where you ingest glucose, you breathe in air, it has oxygen. So by harnessing the energy of glucose, and that is, of course, transported along the proton gradient in the electron transport chain of the mitochondria, then eventually the energy that's transferred, the electron energy that's transferred, allows for the production of adenosine triphosphate, ATP, which is the energy currency of the cell. And of course, when you have an injury or inflammation, the ATP ability to produce this ATP is diminished in cells. So it affects these cells and tissues to heal. They heal slower, sometimes incompletely. And so really what you want to try and do is increase the metabolism of these, affected cells in order to enhance healing. And that's exactly how laser therapy works. So as a very quick review, this is the electron transport chain. There's quite a few enzymes that are involved. Really, the target for photobiomodulation or laser therapy is the second last enzyme of the electron transport chain. That's called cytochrome C oxidase, or complex 4, I believe. And what happens in normal aerobic respiration, as I mentioned, you have a proton gradient pump where the energy is transferred along the electrons, and the protons are transported through channels through this energy, and that energy eventually allows the production of ATP from ADP. So that's normal aerobic respiration. What's critical here is oxygen, which can freely accept electrons, binds to copper and iron subunits within the cytochrome C oxidase. And so oxygen is a key factor here for the production of adenosine triphosphate. Now, what happens in inflammation, chronic, acute, subacute, your patients have inflammation. That's why they're coming to see you. That's what's causing the vast majority of the issues. By the way, please feel free to ask me questions along the way. I'll answer them at the end of the webinar if you don't mind. So what happens here is that one of the byproducts of inflammation is nitric oxide. And without getting into a lot of details, nitric oxide is a highly reactive molecule. It also absorbs to copper and iron much more efficiently than oxygen. So in fact, what happens is as nitric oxide builds up intracellularly due to inflammation, and it's a byproduct of inflammation, it will prevent oxygen from binding as efficiently, and therefore the ATP production starts to be decreased. Now, as cells have depleted ATP, you can imagine what happens. They have less energy. They can't function normally. They can't undergo mitosis and regeneration. They can't normally do the things they want to do, like secrete a collagen, for example, and all these different functions that are required when tissues are injured. You know, a tendon tear, a ligament sprain, a muscle strain, whatever it is you're dealing with, the cells are trying to repair. And if this is inhibited, then it's problematic. And you might say, oh, okay, well, it's a temporary issue. Well, oftentimes it is, and the body will slowly recover. But inflammation is a very, how should I say this, challenging problem for the body, and over responds. And oftentimes inflammation progresses into chronic inflammation, or is just slow to heal for many different factors, including genetic factors and nutrition factors and environmental factors and so forth. So what laser therapy does is the energy of the light, specifically of red and near infrared, it's those two wavelengths that are absorbed by copper and iron within this cytochrome C oxidase. That energy breaks the hydrogen bond between nitric oxide and copper and iron. It displaces nitric oxide. And you might say, okay, well, big deal. What happens, though, is the nitric oxide is freely diffusible through the membrane. So a lot of it will diffuse through the membrane into the extracellular space, into the blood, that causes vasodilation in the general area. And that's one of the benefits, by the way, of photobiomodulation. The other thing is nitric oxide, it has a very short half-life of, I think, 4 or 5 seconds or so. And therefore, it will dissociate as well. This allows oxygen to start to bind back onto cytochrome C oxidase. By doing that, you start to produce more ATP, and it becomes a trickle-down effect inside the cell for the reasons that when you produce ATP, you also generate what's called ROS, or reactive oxygen species, or free radicals in small amounts, do amazing positive things within the cell. And so if you look at the big picture here, when the light comes into the cell, and you can see this is a cutaway of the mitochondria, what happens is you get increased ATP production, which can enhance the sodium potassium pump because it requires ATP. Nitric oxide, as I mentioned, freely diffuses outside the cell. You get an increase or short spike of ROS. This triggers nuclear factor kappa beta, a really critical enzyme in certain concentrations that helps the cell produce or translate stress proteins that protect the cell against further damage. So by doing this, it's called cytoprotective signaling. Now the cells, especially if you start to treat them over a consistent period of time with light therapy, these cells now start to heal and are protected against further damage. And therefore you get tissue regeneration repair that Andre Mester first observed in the 1960s. That's how essentially it works. Increasing mitosis, decreasing inflammation, vasodilation, having an effect on the immune system. And that's a systemic effect I mentioned earlier. Reduction of edema. It can also block pain temporarily and over a long term by reducing inflammation, and it can modulate collagen secretion and maturation, extracellular matrix production, scar tissue formation. The list is quite extensive. So that's essentially how it works. Now, what you need to understand about photobiomodulation or laser therapy is that it's considered a biphasic dose response. You cannot just grab a laser and start to treat blindly, not knowing what you're doing. Because if you use too little light, so A to B is too little light, there's no benefit at all to the tissue. You need enough light to cause a reaction. Okay, so now you're increasing the light and the power and the treatment time. Now you're getting a good positive reaction, right? Okay, so now you start to see some improvement. And eventually you'll get to an optimal dosage or amount of light that really has benefits for your patient. However, more is not better. If you continuously increase the power or treat too much with too much dosage, notice that the photobiomodulation effect that's between D and E1 starts to decline. So the effects are not as good. And then if you overdo it and heat up the tissue, it becomes inhibitory. Now, you can use inhibition to block pain, but what you don't get is photobiomodulation. Okay, so there is a form of laser therapy that is inhibitory, and you can use that to block pain temporarily. The problem with that is that it's temporary and you miss out on all the positive cellular effects. So to be honest, we focus on the photobiomodulation, tissue healing aspects. And if you use high-powered light, like a class 4 laser, which are all over the internet saying they're the latest and greatest and blah, blah, blah BS crap, they seem to think that they can do both, and they do not. They do one thing well, block pain. But what they don't do, because there's so much light and so much heat generated, is they don't do photobiomodulation. Sorry, guys, they just do not. Okay, so there's two effects of photobiomodulation. One is directly on the cell. So if the cell that's injured or inflamed absorbs these wavelengths of light, you can help the mitochondria become more functional. That's a direct effect. Now, the other thing that's really critical about photobiomodulation is that if you treat a large volume of tissue and blood and even bone marrow, the light can be absorbed by circulating white blood cells and stem cells. This is a well-known phenomenon, and I'm going to show you some research to show this, is that when it does this over a period of time, you increase the number of circulating white blood cells and stem cells, and you shift the white blood cells to a state of anti-inflammation secretion. So that is anti-inflammatory cytokines and leukotrienes that are mediated and carried in the blood around the general area that's inflamed and injured. And this can also help those cells and tissues to heal faster. So when you do both these, then you'll have an even better overall clinical effect. But to achieve a systemic effect, you can't really do that with a laser pointer or a single laser diode or whatever, because the blood has to be irradiated for a fairly lengthy period of time, not just a few seconds. We're talking many minutes. And clinicians love to treat quickly, and that's fine. But if you're doing systemic photobiomodulation, you can't do it quickly, and you need to take a bit of time with your patient to achieve this effect. So some of the systemic effects that have been observed include inhibition of prostaglandins, reduction of inflammatory cytokines, increase of anti-inflammatory cytokines, release of nitric oxide, as I mentioned, effects on the white blood cell numbers, as I mentioned. It can actually promote the release of cortisol, which is a natural anti-inflammatory mediator as well, can cause a localized mast cell degranulation, increase macrophage activity, which is really critical in wound healing and tissue healing. And it also can release endorphins and enkephalins to give you some temporary pain relief in your patient as well. It's important when you're using laser therapy that you explain to the patient what you're doing and the net result, because they may feel really good after one session or right after, and then go for a run or on their plantar fascia feet and then aggravate it and thinking that they were better. So you need to explain that they could have temporary relief, but the goal is to heal, and that's going to take a little bit more time. So let me give you a great example of the systemic effect of photobiomodulation. This particular paper was published in part by Yuri Oron. We know him quite well at BioFlex. He's presented at some of our master classes. He's considered one of the world-renowned experts in photobiomodulation. This particular experiment, what he did was he wanted to see if treating the bone marrow of a pig had any effect on a myocardial infarction in the heart, obviously, of the pigs. So in other words, by treating the bone marrow of the hip and the tibia, would it have any effect on the healing and scar tissue formation of the myocardium after a heart attack? So how he did this essentially was he used a balloon catheter. He ballooned out one of the coronary arteries in a very specific area, and that caused a myocardial infarction in a very specific area. I think it was a ventricle, left ventricle of the pigs. some of which weren't treated. And some pigs that had the myocardial infarction had little holes drilled into the bone marrow of the tibia and the ilium, and he irradiated inside the bone marrow with light. I believe to use infrared light. And then he did coronal sections, planes of the myocardium of the heart after a period of time, and he observed what was going on, the healing. And this is what he found. So the first yellow circle shows the area, I think that's a ventricle, but I could be wrong. I'm not a cardiologist here, folks, but, but I'm pretty sure it's a ventricle. So notice the white is the scar tissue. That was a control, no laser. Same time frame on the right side. If you look closely, you'll see a little bit of tiny white. That's scar tissue. Over 60%, I think it was 68% less damage to the myocardium, the muscle tissue, compared to the control. And you can see it as I go along here. There's significantly less scarring and damage on the laser treated pig than the control. Okay, so what's happening here? What's happening is that they observed that there's an increase in stem cells and activated white blood cells that when they circulate, they look for problems. And of course, that's a big one, myocardial infarction, and they help to repair that tissue. That same concept is what's going to happen when your patient, if you're treating arthritis, a muscle strain, a tendon tear, whatever it is you're doing, if you treat bone marrow, which is really hard to do, you're not going to drill a hole in your patient, but if you treat the blood, it also has a very similar effect. And in fact, he did a follow-up experiment on humans, treating just the blood, well, over the bone, but also the blood. And even though these human patients didn't have significant differences in myocardial infarction damage because they weren't able to get into the bone marrow, they did show reduction of chemical or markers like creatine kinase that were lowered in the laser treated patients. In other words, laser therapy had some kind of positive effect on the amount of damage. So what happened in this experiment, in the human experiment, is people that had a myocardial infarction, heart attack, as they were wheeled into the hospital in Tel Aviv in Israel, some of them were treated with laser therapy over the some of the long bones or the hip. I'm not sure which it was. And that's what they noted. So we know there's a systemic reaction. It's well documented. Wow, I've already gone for almost half an hour. I'm going to go over time here. I'm telling you right now, folks, because I have a lot of information, so I do apologize. If you have to leave early, no problem. You'll be sent a recording. If you look at the research, when I just did a little search of PBMT, which is photobiomodulation therapy or low-level laser therapy, you can see there's over 7,700 research papers on that. Every year, there's 600-700 papers being published. If I just search for clinical trials, human clinical trials, there's over 1,500, and every year there's well over 100 human clinical trials on photobiomodulation therapy, some of which are really impressive. Roberta Chow's paper, Cochrane collaboration reviews, positive feedback or guidelines in the American College of Physicians and Surgeons, the British Medical Journal, for example. So in the in the American College of Physicians and Surgeons in 2017, they were studying and gave recommendations on evidence-based guidelines for non-pharmacological therapies to treat low back pain. And they mentioned all sorts of things that we know already as a chiropractor, which was what I am, or massage therapist or physiotherapist or whatever it is. We know active therapies are critical. They were all considered to be effective, exercises and so forth. The only modality that they even considered to have enough evidence was low-level laser therapy. Interesting. Roberta Chow published a meta-analysis in The Lancet, one of the world's most read and highest impact factor medical journals in the world, talked about neck pain and laser therapy, and they looked at over 16 randomized control trials, and they concluded that laser therapy reduces pain both immediately after acute neck pain and up to 22 weeks for chronic neck pain. Let me just back up a bit here, sorry. This next paper, was on the British Medical Journal on osteoarthritis of the knee. And similarly, there was a meta-analysis. They looked at 22 clinical trials, over 1,000 patients. Again, they concluded that laser therapy reduces pain and disability in knee osteoarthritis. In that particular paper, they looked at quite a few clinical trials. And this next one, it was a Cochrane collaboration, and it was on frozen shoulder. And they looked at 19 trials. And the only modalities that had clinical trials compared to placebo was laser therapy and PEMF, or pulse electronic magnetic field therapy. And when they looked at those two, they concluded only laser therapy had enough evidence to recommend it, along with exercise therapy, no other modality. This one I just read actually today, and it's on laser therapy for tendinopathy and or plantar fasciitis. Again, a systematic review, meta-analysis, that has the most obviously weight when you're talking about if something's effective or not. So they looked at 10 trials, and they concluded that the laser therapy significantly reduces pain and disability in lower extremity tendinopathies like Achilles tendinopathy and plantar fasciitis, both in the short and medium term. Very few studies looked at long-term follow-ups, but medium term is several weeks, so you can consider that to be pretty much curative at that point. This one came out in August of 2022, a British Medical Cancer Journal, and they were looking at photobiomodulation. Notice they're now talking about photobiomodulation for the management of breast cancer-related lymphedema. Again, a systematic review, and they concluded that laser therapy, or PBMT, was successful in diminishing arm circumference and volume, although it didn't have much improvement on shoulder mobility in these patients. Okay, so when talking about modalities, there's many out there. There's, TENS, there's PEMF, there's ultrasound, there's shockwave. And I'm not saying that some of these don't have a positive effect on tissues and on your patient. What I'm here to tell you is that there's overwhelmingly more evidence for laser therapy than all of these combined. I cannot emphasize that enough. So for example, in TENS, IFC, electrical muscle stim, these typically have short-term pain relief, which of course is helpful, but may not do a lot for helping healing. Of course, EMS is helpful for strengthening, so that can be good as well. But when you're comparing TENS to laser therapy, TENS is more of a temporary pain reduction as opposed to a prolonged healing effect of laser therapy. And these particular types of modalities have a lot more contraindications as well. Therapeutic ultrasound, there's two types. Pulse and continuous, whether it's heating or in a pulse mode, non-heating, it can work in different ways. I think they're still trying to understand the mechanism. And in some of the papers, they do say that it's helpful, but there's still quite a few. For example, this one by the American Physical Therapy Association, one of the prime practitioners, physiotherapists that might be using ultrasound, and they concluded that there was little to no evidence that active therapeutic ultrasound compared to the placebo was helpful for any type of musculoskeletal injury and healing. So it's still a little contradictory, the research, and personally, I stopped using it after a couple of years in clinical practice because I did not see any huge benefit with it. I may be wrong, but that was me. Pulse electromagnetic field therapy is interesting. They make tons of claims. Their research is still in its infancy. I have seen good results with it. It can be very helpful. The mechanism is kind of unknown. They're not quite sure. It may affect pain. It may help with tissue regeneration, anti-inflammatory effects. Not quite sure exactly how it works. The evidence is still in, like I say, very early on. It may be helpful. I think there's only 105 clinical trials to date. So I would say this: if you're going to use PEMF and you're going to choose one or the other, I would go laser therapy. And then if you can afford it, get a PEMF as well too, because I think it may also be helpful. But if you're looking at research and evidence, laser therapy is certainly much stronger than PEMF. Extracorporeal shockwave. I actually like the shockwave as well. Again, the problem with shockwave is that it has few indications, that it's still contradictory. I mean, you can read trials that say it's not effective, for example, for tennis elbow, for example. And there's a lot more contraindications. Some patients can't tolerate it because it can hurt. So, you know, it's again one of those things where it can have a good effect. In fact, if you do it first in laser therapy, you enhance shockwave benefit. But again, if you're choosing one or the other, I would go with laser first and then shockwave kind of scenario, just because of the contraindications and the limited indications for shockwave. And again, I'm just giving you the references as I go along. Frozen shoulder, I mentioned that earlier. This is a Cochrane collaboration, and they concluded that the only modality that was effective was laser therapy, along with exercises, by the way. So really, my conclusion for modalities is that they can be helpful in clinical practice, but you need to understand their limitations, their contraindications, their indications, and how they work, and then decide, is that going to meet the criteria that add to your clinical toolbox? Personally, if you look at laser therapy, this is the only one that has a direct effect on ATP production, the metabolism of cell regeneration, and its ability of cells and tissues to repair. It's a very versatile form of therapy, and you can pretty much use it on anything that you treat in your clinical practice. So as far as what it's going to treat, obviously the musculoskeletal system, the nervous system, dermatological system is effective. Lymphatic system, I mentioned that earlier. Post-surgical healing, for example, post-knee replacement surgery, shoulder surgery, whatever it is, it will be very helpful. Recalcitrant wound repair. Even in the cosmetic world, we've all heard about red light, you know, for skin conditions or energy, well-being. And there's some truth to that for sure. So we know it has lots of different interesting applications. And there's emerging applications. For example, traumatic brain injury, we're starting to see some really positive results. Gastrointestinal issues, whether that's irritable bowel syndrome, gut inflammation, those kinds of things, because of the systemic reaction, may be very helpful for that as well. We've seen positive effects. Even in the realm of pelvic inflammatory disease, issues with infertility, dysmenorrhea. Actually, we're doing a trial on dysmenorrhea, and we've just finished one up on vulvodynia, painful intercourse, and showing good positive results. These papers will be published over the next year or so. So our equipment is very unique. We've been around for over 30 years, and we've developed both professional and consumer or home care products as well. And the key thing here is that we are a clinically oriented company. We provide clinical support to both consumers and professional healthcare providers as well. So really, that's what we do as a company. Our founder, of course, was Fred Kahn, a vascular surgeon. After an injury to his shoulder, he ended up having some red laser to his shoulder, really was helpful, ended up designing and developing what we know now as BioFlex laser therapy. Lots of different devices that we have. We're into our third and fourth generation of equipment. As I mentioned, we have professional grade equipment and consumer grade equipment. They're all based on our professional systems that have been developed over the years. We've been in the media a lot, whether it's David Suzuki, Nature of Things, Brain's Way of Healing by Norman Deutsch. If you search some of these names, you can find a little bit more about, especially about the effects for neurological conditions and neuroplasticity. So we have definitely been around and doing a lot of research. We currently have 6, 7, 8 trials undergoing, and we're soon to be working with York University and several other institutions to get a little bit more clinical trials done and research, which is very helpful, obviously, for understanding the benefits of photobiomodulation. Now, our devices look like this. We have a large surface array. This promotes more of a systemic effect and is on the tissue hands-free for about 15 minutes or so, 20 minutes, it depends, not usually 20 minutes. And then we have high-powered class 3 laser probes that have more of a direct effect. So you apply it on the patient, hands-free. Initially, it's red light for 6, 7, 8 minutes, and then infrared light or near-infrared light for another 6, 7, 8 minutes. And then you follow up with a direct effect on using a class 3B probe. So depending on the amount of tissue that you're treating, the area that you're treating, treatments can be as short as 10, 15 minutes or much longer. Of course, depending on the equipment you have, you can narrow that treatment time down significantly as well. One of the things that we focus on with our equipment is that we make sure that the light touches the skin and pushes into the tissue. By doing that, the depth of penetration is much deeper. When you hold light away from the skin, up to 95% of light will be reflected off. It's not advisable. It's always advisable to use a contact technique and keep it on one spot to apply enough dosage. But if you can apply pressure and depress the tissue with the diodes, which is how our equipment is designed, then you will actually achieve a much greater depth of penetration. And everyone talks about depth of penetration, but if you can push the tissue in, you're actually getting a much deeper penetration as well. Our protocols have been clinically proven and used and utilized for over 3 decades, really established by Dr. Fred Kahn in our large clinic here in Toronto. And these protocols have different stages of intensity and stimulation. And of course, we train our users on how to apply it and where to apply it, that kind of scenario, and provide clinical support by our clinical medical staff as well. Upcoming webinars. I have one on sacroiliac joint pain. That's coming up mid-October. And if you happen to be in the Greater Toronto area, we're having a live event in person at the Kingbridge Center. This is in the King City area. And have some guest speakers, including Dr. Benjamin Ewan. This is really to introduce a lot more clinical case studies, a review, a more in-depth review of what I talked about today, hands-on use of the equipment, and also using Dr. Ewan and Dr. Slava Kim and our clinical research director, Dr. Randy Santiago, will be having a practical session and an open forum session on treating different conditions. So if you can make it, whether or not you're a existing BioFlex user or just interested in learning more about it, it's just $99 to register. It's almost a full day event. You get a nice gourmet lunch up there, up in I think it's King City area. So if you're able to join us, that'll be great. Just go to our website under Light Up Your Practice and you'll see the event there. Really appreciate everyone joining me today. A few questions here. If it's safe to use on a two-year-old, well, I'll tell you this, is that our devices are not indicated for infants. Is it safe? More than likely, but that's an off-label use. There's no known side effects, but dosaging, all the rest of it, you need to understand treating infants is a lot different, and you can contact myself or Randy, Dr. Randy, to get a little bit more information on that. How quickly can this be used after surgery? Within 24 hours, you can start using laser therapy for surgery. As far as combining photobiomodulation and pulse electromagnetic field, I think they would work synergistically. And if I had both, I would use both on my patient. A question about if it's useful for plantar fat pad thinning. Unfortunately, that's just an aging problem with pressure on the heel over time. So that is it's not gonna be helpful for that, Marion, unfortunately. Okay, just seeing if there's any other questions here. I think that's it. Again, thanks so much for joining me today. If you have any follow-up questions that you wanted, please email me at david@bioflexlaser.com. If you're interested in a demo, you can email us or contact us and we can do a in-person or a online demo, and you can check out the equipment as well. Thanks, everyone, and have a great day.